Welcome to another in a series of Under the Dome, where we are meeting with Chittenden County local legislators, the folks that are working in Montpelier to make our government run and make our communities a better place to live. Thank you, and we're welcoming today Rep. Daisy Berbecco and Rep. Alyssa Black, both on House Human Healthcare. Welcome. Thank you. Just tell us your position on the committee. You're both on the same committee and the community that you serve.
Go ahead. Do you want me to start, and then I'll pass it to you? So I'm Representative Alyssa Black. I serve Northern Essex, and this is my third term. And I have served on House Healthcare all 3 terms, and this year I am the chair of House Healthcare. Yeah. And I'm going to pass it over to my left hand.
Yeah, I'm on the wrong
my
side.
left hand rep, my ranking member, Daisy.
Daisy Berbecco. I represent Winooski. This is my 2nd term, and I'm the ranking member on House Healthcare.
Yeah, and for folks that don't understand, how do you get appointed to be the chair? How do you get appointed? What is there are ranking members, there's the vice chair. Tell us a little bit about committee assignments and how you came into these assignments.
Well, I came in, when I came into the legislature, healthcare was my #1 committee choice. When, just little backstory, when you become a representative, before the session begins, you will go and you will rank your committees that you wish to be on. And then the speaker, in collaboration with the minority parties, will set the committees. And I am so grateful that I was given healthcare, because I think it was my #1, 2, 3, 4, and 5 choice. So I had worked in healthcare administration for my entire career. So it was something that I felt I was familiar with, where I thought I could do my best work. And, you know, as you serve with each term, as representatives leave or representatives might move to another committee, they might get different committee assignments, then you sort of move your way up a little bit. I had been the ranking member last biennium, and our current majority leader, Representative Lori Houghton, had been the chair. And so when Lori decided to run for majority leader, that left the opening, and so I was moved up to chair, unbeknownst to, much to my surprise. And then it's looking around the committee and seeing, what other members, what their obligations are, because there are a lot of members, Daisy and myself included, that have a lot of responsibilities outside of the legislature, and just seeing sort of who brings the most to the table. And my first choice was Representative Berbecco, and so Representative
As the ranking member.
As the ranking member, because she's again, she sits on my left-hand side, but she's my right hand.
You're talking about in the committee. You have
In
the
the
committee
committee,
room.
yeah, in the committee room.
And Rep. Berbecco, just tell us a little bit about what's expected of a ranking member.
Well, I had, maybe unbeknownst to Madam Chair, gone to the speaker and let her know ahead of session that it was my goal to be ranking member, because I wanted to dive a little deeper into the committee operations and support our chair more closely, right? So I wanted to have more of a voice on the committee, and from what I know, ranking members, from what I knew at the time, ranking members did a bit more of that. So just get a little bit more of the inside on what all is done, the work that's done, the dirty work that's done to get everything organized for committee. So setting the agenda, organizing committee gatherings and things like that. But I think mainly it's driving the agenda.
So let's talk a little bit about that agenda. The House Committee on Healthcare, you are looking at, you're responsible for. Tell us a little bit about what you're responsible for and how, yeah. And then we'll go through some of the bills that have gone in and out of the committee.
So the Committee on Healthcare has jurisdiction over several departments within the Agency of Human Services. We have sort of a sister committee, the Committee on Human Services, and sort of our jurisdictions are split a little bit. So we have everything to do with healthcare, health insurance, mental health care, Medicaid, our healthcare workforce, and human services really stays more in, they have jurisdiction over the Department of Aging and Independent Living, the Department of Health, sort of the public health sphere of things, but we work very collaboratively amongst the two committees when things sort of touch each other. So, bills will be assigned to us as healthcare, but oftentimes, anything to do with substance use disorder is within their domain. So there's a lot of cross-committee collaboration.
And for those who are watching at home, if you want, you can look, and I don't know, Kevin, you can bring up the screen, legislature.vermont.gov, and in this case, we're looking at this House committee, and you can see, if you dig on to the left, the list of those folks who are serving on this committee, and then we'll go through some of the bills in and out of the committee.
Can we
So
give a
both
shout?
of us, yeah, go
Can we
ahead.
give a shout out to our? As I'm sitting here looking, I want to make sure we give a shout out to our Vice Chair Representative Topper McFawn, or Francis McFawn. I'm just reminded as I'm looking. Topper is from Barrie, and he is our Vice Chair. Topper has a lifetime of experience in the legislature, and we work really well with him. Additionally,
He's incredible.
Yeah, he's incredible. So.
Yeah, and so let's get into that a little bit. What both of you are seasoned members of the legislature at this point. It's a new biennium, but you've been there. This is not a new year for you. What's it been like in the session so far this year?
Oh my gosh. It's been a very different session for me. I feel like healthcare has, being a policymaker in healthcare has always been feeling like crisis response. But this session in particular with the condition of our hospital system has been full steam ahead with responding to that crisis. The good thing about that is I really feel like we are making a difference. And we are working collaboratively with all stakeholders to do that.
Tell us a little bit about when you say the crisis, what are you referring to?
Alyssa has responded with some really wonderful legislation. I think she should talk about that legislation.
Well,
126.
and certainly feel free to jump in
I
on
will.
this. So, obviously going into this term, the overarching theme of it has been around education and property taxes. We know that that is the highest priority in Vermonters' minds. And, to those of us that serve on the healthcare committee, we do know that a lot of what is driving that is healthcare. Because the educators and school-based insureds, their health premiums are going up just as much as everybody else's.
Yeah.
And a lot of that is what is driving the increase in property taxes.
Yeah.
So the same hits that Vermonters who are not state employees or are not on teachers' insurance who have health insurance through their own employers, the same pressures and the same increases that those people are seeing, you have to remember that those other areas are seeing the same ones, and that is what is driving a lot of the tax increases. We've also been faced, which we actually didn't know before we were coming into the session. We had kind of an inkling and there were rumors, but it all came so fast, is we're dealing with the possible insolvency of our one domiciled health insurance company in Vermont, and that is Blue Cross Blue Shield of Vermont. Blue Cross Blue Shield of Vermont insures either directly through their small group market, the individual group market, which is the exchange, and a lot of the larger group market, plus many of the self-insured plans, so think teachers, think state employees. Over 70% of Vermonters who are not on Medicare or Medicaid have Blue Cross Blue Shield of Vermont.
And they're facing some financial crisis.
They are facing a major, major financial crisis. Their days cash on hand became so low that it would have triggered a response from the Department of Financial Regulation to put them into receivership, which is something we do not want to happen. And the only way they were able to get out of that was to take a loan out from Blue Cross Blue Shield of Michigan to raise their days cash on hand to just above insolvency. That loan that they took out was at an incredibly high interest rate, and Vermont ratepayers are going to be paying that interest rate.
So what's at the crux of that, and what legislation, we're looking here at the bills in and out of the committee, what's in the hands of the legislature that you can do to affect that?
We have been taking testimony since the day we started in January, and to be brutally honest, what is driving that is hospital costs, hospital outpatient costs specifically, and hospital prescription drug costs. At the same time, we're also facing really dire financial conditions from a lot of our hospitals. And so it's this balance between trying to maintain our system of care so that all Vermonters have access to the care that they need. We always say the right place, the right time, for the right cost. And trying to be able to maintain that while also realizing that the insurances that are paying for that will go away if we don't strike a balance between that. So that's really what we've spent a lot of this session working on.
Do you want to add to that?
I would just flag H482. I think did a really, our whole committee worked so hard on legislation that would really balance the voice of patients as well as regulators, and give some guardrails, I guess, to some of the financial situations that can come up. And I think also just listening to Alyssa speak, it really gives sort of a sense of some of the complexities in this legislation, right? With insurance and budgeting and regulation. It is complex stuff. And even, this is my third year coming to the end, and I'm not new to healthcare. I'm new to hospital systems. It's been incredible watching how, people representing the hospitals, people representing, Vermont Legal Aid and Office of the Healthcare Advocate have been absolutely incredible with, getting folks in the legislature up to speed on what the issues are. And I mean, this has been so educational. It's unbelievable. Most people, I mean, we're citizen legislators, right? Like, it's just unbelievable the way that we work with all of the representatives to really learn what's the right thing to do.
And the complexity, just the complexity of it. There are no easy answers.
So let's talk about H482 a little bit. We'll just bring that up here. And this was introduced.
It was introduced by our committee. So it became very apparent about halfway through the session that Blue Cross Blue Shield might not make it another couple months. And there needed to be some sort of legislative action. One of the challenges of this year, you asked sort of at the beginning about being here multiple terms. One thing that has been very apparent this year is that there's no money. There is no money from the state coming in to save anything. The state does not have, and taxpayers, when I say the state, that's taxpayers. Taxpayers do not have the money to be able to solve the issues with Blue Cross Blue Shield. If Blue Cross Blue Shield were to fail, it would mean the loss of insurance of over 70,000 Vermonters. It would also mean the collapse of our entire system of care, not just hospitals, but we didn't even talk about the complexities of adding in where the federally qualified health centers, FQHCs, there are FQHCs within the state who have a handful of days cash on hand.
To translate, that's
yes.
the community
Cash on
health
hand.
centers of Burlington and that whole network.
Communities right over there, community on Riverside. And there's a whole system of care. I think, I can't remember the total, but
14?
I think our FQHC's primary care serves how much of the population?
Oh gosh, I don't know that.
It's a huge percentage of the population. That's their primary care. Independent primary care. Hospitals throughout the state, it would mean the collapse of those. A few days without claims being paid from Blue Cross Blue Shield would mean devastation across the state. So we were in this position of essentially, where can we find money to shore up Blue Cross Blue Shield? And there are hospitals in this state who their financial position is such that, frankly, they could afford, and I am willing to say, pay back Vermonters. And that's really what H482 was. It was allowing our regulator to go into hospitals who are in very good financial positions.
And the regulator in this case is the Green Mountain
The
Care
regulator
Board.
is the Green Mountain Care Board, to be able to go to hospitals and make rate adjustments mid-year to be able to pay back ratepayers through
this
insurances.
has to do with equalizing. So if a procedure costs X amount in 3 different, is this the translation of this?
That's in 120. That's like more
That's more
reference
120.
based.
Do you want to try to explain sort of the difference between rate setting and hospital
the reference-based
budgets?
healthcare. Yeah.
No, I think what you're getting at is more about, she's saying that this bill 482 allowed them to do that, look back at the rates at a time that's outside of the season they usually do it, which is during hospital budgeting time.
So who are you hearing from to make these decisions? I mean, the work, as you referenced, your citizen legislators, you're coming into this, you're representing your constituents' interests. the most of the work happens in these committees based on the testimony of both experts and citizen witnesses. So who are you hearing from in your committee, and who are you not hearing from?
I think in committee, we're hearing from a lot of folks that is sort of, much of this is around the healthcare reform that was prompted by the Oliver Wyman report. So that follows from Act 167 that took place last year. So I think Alyssa and Lori Houghton talked about that in their CCTV interview last year. And so that also leads us to S126, which started in the Senate, of course, and then came to us. We've just passed it out from House Healthcare, but it's very comprehensive healthcare reform, and much of that ties into regulatory changes. And I think this specific 482 is a more immediate change that responds to the health or to the hospital budgeting, but 126 is a much more comprehensive solution with some both short and long-term responses to stabilize primary care, as well as the financial pieces. I think it also speaks to that.
Hospital sustainability.
Yeah.
You know, the Wyman report came out last summer. We did Act 167 in 2022. It was actually in my first term. And it was sort of a long-range goal of right-sizing our system of hospital care. It was a hospital sustainability bill. And so for the first couple of years, the Green Mountain Care Board was tasked with, getting the state of hospital care within our state. And they came out with their reports in last summer. And there was a lot of conversation around that. There was a lot of outrage around that. There was a lot of pushback from it, and
who's outraged? Who's outraged and who's pushing back?
I think hospitals and the communities also that the hospitals serve. The thought of losing the care and the types of care and the availability and accessibility that Vermonters have, sort of become accustomed to. Unfortunately, we can't afford that. And the Wyman report really was about envisioning a whole system of care within the state instead of being siloed in various regions and each area competing with the other for essentially dollars. I mean, hospitals are competing. It's a race for dollars to keep themselves afloat. And there just hasn't been much collaboration between hospitals. And the Wyman report really was re-envisioning the care that is needed and delivered in various regions within our state, ensuring that everybody has equal access to the types of care that we really do need. Long-term care, primary care, emergency care. And so there was a lot of pushback about it because change is really hard. And imagining something else is very difficult. The only thing that the Wyman report got wrong was the time frame, because it had predicted the closure of at least 5 to 7 hospitals in the next 5 years if things didn't change. He got it wrong. They got it wrong because we are now looking at that within 1 year. And so 126 is really an extension, S126 is really an extension on that work and speeding up the timeline of the transformation that needs to happen. There's a large piece in it which is just kind of developing with stakeholders a statewide healthcare delivery plan, because we don't have that in the state. Where should things be located? Where should there be centers of excellence? I mean, we have primary care deserts in this state. We're in Chittenden County right now, and everybody in the rest of the state thinks we're lucky, and we do have those resources. However, I will tell you, even in Chittenden County, call a primary care office and try to get a new physician, because the wait lists are sometimes a year or 2 years out. Well, it's worse in the rest of the state.
And why, when you need to see a specialist, you have to go to the hospital where you're paying a facility fee on top of that? You know, we are talking about really getting care back in the community where it belongs.
So 126 envisions, and it has sort of medium term. It also has some short term plans. There's pieces of it that speed up the Agency of Human Services response to Act 167. Previously, they had a while, and we've sort of said, no, this has to be done now. It has to be done now. There's no options.
We asked for that report a year from now, right?
Yes.
Yeah.
One year from now.
We only have a little bit of time, and I feel like we just sort of barely picked up the surface.
Welcome to
'Cause it's
our
a big-
world.
Yeah. So for folks that want to know, I mean, I guess this is the question of what do you need to hear from your constituents about, and what do you need them to be paying attention to?
I would say from our constituents, we need our constituents to reach out to other legislators and let them know that they can no longer afford this. I will say that the insurance companies came out with their rate increases for next year. They submitted them to the Green Mountain Care Board. They are horrifying. It's horrifying.
What can you tell us? What those? Do we know those numbers yet, or is it?
So
I mean, this still is subject to approval.
Yeah, and we haven't even gotten into the federal.
Well, that was how we were going to wrap up.
We don't have enough time.
Yeah.
I can't even imagine.
And what you're talking about is potential cuts.
We are talking about
yeah.
catastrophic cuts from the federal government, not only to our Medicaid program, but also just very simply, and this plays into the rates, the Vermonters have really been insulated from a lot of rate increases because of the enhanced premium tax credits that happened during COVID. So starting in 2020, the federal government started subsidizing so that no Vermonter or no American could pay more than, 8 point.
Oh, I don't remember numbers well.
It's somewhere around 8 to 9% of their income could not be spent on their health insurance. So Vermonters have been receiving these additional tax subsidies. Barring congressional action, which it does not look like there is going to be any action, those tax credits expire at the end of this year, which will mean a family of 4 making it's 400% of poverty level, they will lose all subsidies. A family of 4, I think, is 400% of poverty level. Seems like a lot. It's really not. It's $128,000, about $130,000 a year. That's what you make. That doesn't, think you still have housing and childcare and all of that. Right now, a premium for a family of 4 on the exchange is $3,900 a month. Most Vermonters do not pay that. Starting in January, it will be $3,900 for a monthly premium for a family of 4, and with the increases that have just come out, it is looking like they would be closer now to $4,900.
So you're sounding an alarm.
$5,000 is not affordable.
Yeah.
People will go without, and the more people who drop out of, and these are small businesses, small businesses are paying that amount for their employees.
How is this playing out in a partisan way in the legislature, given what is incredibly partisan politics on a federal level? How is it playing out in the local level?
In the local level, and I work with all the parties very well, and I'm finding it. I've observed many people from the Republican Party are challenged to support any legislation that has a price to it at all, no matter how much it helps their constituents stay alive.
I think there's been incredible bipartisanship on the part of, H482 passed out of our committee at 11:00, and it passed on the floor. I believe it was a unanimous voice vote. There might have been one nay in the back. I'm not sure.
Just for fun.
And the Senate passed out S126 unanimously. There has been pushback from people in certain communities because I don't think they have the full information. But I will
Outside the legislature.
outside the legislature, it's very hard to really explain to people what's going on and why it's happening. And it's scary.
Yeah, change is scary.
Change is scary. And it's going to be painful. It's going to be painful to all of us. But the alternative is not an option.
Are there plans to do some more, like right now we're doing some town halls and some meetings on education. Are there any plans to do that with your constituents around healthcare for folks to get a handle on this, to be
I'm
involved
doing
in
one
understanding?
on the 19th at 6 p.m. at the Winooski School with our Attorney General, our State Treasurer, myself, Senator Martine Gulick, and maybe the Secretary of State as well. And we're going to talk about some of the federal changes that are taking place and how it impacts Winooski in particular. And healthcare will be part of that, of course.
Yep.
Can I?
Yeah, go ahead.
Before we close, I really want to highlight some of the positive things
We've
Awesome.
that
done
we
some great
brought
stuff.
to Vermont
please.
this session,
Yeah.
especially around reproductive rights and gender-affirming healthcare, because I'm really proud of the work that our committee did there. We did a follow-up to the SHIELD bill that we passed last biennium to really enhance those SHIELD laws for our providers.
This is protecting folks that are either providing reproductive health care or gender affirming care, is that right?
That's right, yeah.
We've filled some holes that have come up since we passed it last year.
Yeah, so we're still there. We're not, it wasn't a one and done kind of issue. We're still strengthening it wherever we can. We also, I think this is going to pass over in the Senate right now, S18, which is licensing freestanding birth centers. We're one of few states that don't have those.
In other words, if you want to have a baby, you have to go to the hospital or have it at home, and there's no in between.
That's right.
And this allows for folks.
And this is an affordability issue because, for those who don't want to give birth in their own home, their only option is the hospital, which is a much higher cost.
And very traumatic. And when you look, it's Black Women's Maternal Health Month, and when you look at outcomes for Black women's maternal health, it's really, really tragic. And so when we think about opening up all the options we possibly can for those moms, this is really promising. More choices, the better. And hospitals are not serving those women.
We've done some work around workplace violence in hospitals.
H259.
Yep. Vermont has one of the highest rates of days missed from work from employees who work in hospitals and are fearful or have had something happen to them.
Yep.
So that's really important. You know, supporting our healthcare workforce is very important.
Also doulas. It's
doulas.
a great bill,
That's a great bill.
S53.
And are these birth doulas, death doulas, or all the
These
doulas?
are birth doulas, and we've done a lot of work on this over the years to get us to the point where we're finally able to have a certification. It's a program too for our Office of Professional Regulation to actually be able to certify doulas so that eventually they will be able to bill Medicaid for their services. I went into this year telling everyone that if it was a bill that expanded coverage for anything or cost anything to state Medicaid, I wasn't passing it, and I wasn't going to take it up. You can talk about the power of a chair. I'm not going to do that. However, the doula bill is the one bill because studies have shown just how much they actually save the system.
Now, is this, to be fair, is this actually going to cost anything, or this certification
It
program?
costs a
Or-
very, very
Yeah.
tiny amount, but the care that pregnant people receive with a doula lowers costs in C-sections, epidurals, preterm,
Infant mortality.
infant mortality. We heard some actually kind of devastating numbers around postpartum or perinatal deaths in the state of Vermont, and doulas really, decrease those. Gosh, we printed out this list and it's exhausting. looking at it. I'm like,
S27, the treasurer's
oh,
bill.
the treasurer's bill. This is a great bill. Like, can we end on this bill? I
Yeah,
know we only
it's a
have.
great bill.
And just so folks know, again, you can go to legislature.gov.vt and find this committee, and you can see all of the work. This is, again, a policy committee, so any bills that are coming out of this affect policy and may or may not affect money that is spent. But yeah, go ahead and end on.
Do you want to talk about S27?
Yes. So S27 is a bill that was brought to us by the treasurer. He found an opportunity to take a small amount of money. I think it was, big amount of money, but have
It's
a
big.
bigger impact.
But it was money that that the treasurer's office had appropriated to them for other things years ago, and they were never able to spend it on that. So that money has just sort of been sitting in the treasurer's office.
Just waiting to pay off some people's debt. So we appropriated it to this fund, which can pay off people's debt, medical debt, and we can pay it to creditors or people that have bought the bad credit. And so this helps both hospitals as well as residents because they then don't have the debt. Hospitals don't have the bad debt. And so I think we spent $1 million, and it will end up paying off how much?
$100 million in debt that currently has been written off by hospitals and healthcare providers to bad debt and has been reported to credit agencies. And so this is on someone's credit report, which, makes having that sort of thing on your credit report makes everything in your life harder. Rent a house, buy a house, get consumer credit, a credit card, your interest rate will be higher. Buying a car.
Is this an ongoing program, or
This
is
is
it
a one-time program. And this,
what's the time frame of it? How does someone learn about it or get?
well, actually,
resources?
people will learn about it only when they receive a letter from the treasurer's office that says your debt has been written off and it is no longer on your. The really important part about this is removing it from people's credit
reports, right.
report. And it also makes it so that going forward, medical debt cannot be reported to credit reports. That costs nothing. That's just a ban on medical. And the federal government had actually done this a couple of years ago and that provision has been rolled back by the federal government.
Oh, I was kind of curious because I had thought that medical debt wasn't. So
Yes,
this is
it's-
a way of the state.
Yes, this is
stepping
the
in
way
where
of the state
federal
stepping
government's-
in.
Yep.
So that will help going forward. But this is $1 million, which it's a lot of money, not negating what $1 million is, but it is estimated that it will pay off over $100 million of Vermonters, and that really
look for
helps
those
Vermonters.
letters,
Look for the
Yeah.
letters.
Yeah.
Look for the letters.
Thank you both for being here and for your work in the legislature.
Thank you. Thanks for
And
having us.
Thank you all for watching. You've been watching CCTV, Town Meeting TV. This is part of our series Under the Dome, legislative updates from Chittenden County legislators. Thanks for watching.